Heart Failure Summit 2023 organized by CSI West Bengal chapter. And for the last session, may I please request Dr. Arup Das Bishwas, Dr. Shivanando Dotto, Dr. Shapun Pal, Dr. Jyotirmoy Pal, Dr. Bishwarup Sarkar, Dr. Shubhankar Bhattacharya to join the session as the respected chairpersons and panelists. And our last speaker would be Dr. Indranill Basu from USA, and he'll be giving a popular lecture possibly because it is Yoga in Heart Failure. Indranill Basu from USA. We also had him yesterday with us in one of the sessions. It's a proud privilege again to introduce him. Dr. Basu is a staff cardiac electrophysiologist and the director of cardiovascular research at the Memphis VA Medical Center and an adjunct professor at the University of Memphis. He's also a visiting professor of cardiology and head of integrative cardiology at All India Institute of Medical Sciences as Rishikesh, Uttarakhand. He is a faculty mentor at the MIT University in biomechanical engineering to developing newer technologies for cardiovascular disease therapy. He's also a practicing yogi and a meditator trained in the Kriya Yoga meditation and is the editor-chief of the world's first book called The Principle and Practice of Yoga in Cardiovascular Medicine. So Dr. Basura, it's all over to you right now. Thank you all our respected speakers and panelists who have joined in this session. The last session of the two-day-long conference on cardiac heart failure is to be addressed by Dr. Indranill Basu. Thank you.
Good evening, everybody.
Welcome, Indranill. Arupda here. Nice to see you.
I can see you, Arupda. No, sir.
Yeah.
Hello.
Okay. We'll discuss later. Yeah, please continue.
So, good evening, everybody in India, and good afternoon or good evening, good morning from people the rest of the world. I again like to thank Dr. Banerjee for having me on this. And so today's session, I think, will be interesting and both challenging. Challenging because we have some of clinical cardiologists and researcher here, and I'm going to talk about a topic which sometimes may not be considered medicine, but at the end of the talk today, we will see that yoga is actually a medicine. And yes, so this is the book we wrote with over 80 authors all over the world, from Harvard Medical School, Emory, PGI Chandigarh, NIMHANS, name it. They're all allopathic physicians. So there has been a lot of research in yoga, and hopefully I'll be able to prove to this August gathering that yoga is actually a medicine and how we should be using it. Can you guys see my slides? Is it seen now?
No, not yet. We can see you, okay. We can hear you well, but not your slides. Have you shared your slides?
Let me do that. Share screen.
Yes. So now it is visible.
Now it's visible, right? Okay.
Can you make it full screen?
Yeah, I'll make it full screen.
Yes.
Is it visible now?
Yeah, it's quite good.
Okay, thank you very much. Again, it's a privilege to be in front of a lot of people like Arupda and Subhananda. These are my mentors, my seniors. It's really a privilege. And thank you, Dr. Banerjee, for having me. So, cardiac, without wasting time, let's go. Heart failure is a big problem. It's almost in an epidemic proportion. There are more than 26 to 30 million people worldwide with heart failure. And in India, it ranges from 1.3 to 4.6 million based on what the records I could see. And it's a progressive disease. In US, there's over 6.5 million people. And by 2050, we'll have 4 times the number of heart failure than we have today. So it's a big problem. But what is a bigger problem is not only the large number of patients, but the cost. This slide is busy, but I'm just going to point out 2 important factors. In 2020, the total cost of treating heart failure was half a trillion, that is $50 billion. And that's in only United States of America. And that is going to be almost nearing 100 billion in 2030. So imagine what is going to happen in 2050. And we all know India is slowly becoming the capital. India has already become the capital of diabetes mellitus. Possibly it will become the capital of coronary artery disease also. It's expected that in 2025, India will have more heart attacks than America. So of course, we are looking for an epidemic for heart failure in India too, and that is progressive. So I think it's important to understand that something like yoga can actually play a big role in this. So we know the management of heart failure. I don't want to go into all this. We have nice drugs. Now we have devices. But we have to understand that despite all this, there's a large percentage of people who do not respond, or they do not follow what is needed to respond. And that's an important question. Who do not follow what is needed to respond? Because most of these people are on 2022 medications. They need a change in lifestyle, restriction of water, taking their medications at time. That doesn't happen. So you might have the world's best drug, you might have the world's costliest devices, but that's not going to benefit your patient until you can change the patient. So putting it in very simple terms, that I can get the world's best seed from Monsanto and I try to put it in a rock. The rock, you will not get that plant. So the rock has to be changed to a soil that will grow that plant. And unfortunately, as all of you know, who treat heart failure, that we are faced with these patients. We have 15, 20 minutes with them. We tell them, we give them medicine, but that doesn't mean anything unless they really change their own lifestyle. And remember, these devices are not cheap. I don't know the cost in India, but a CRT costs $60,000 in US. CCM, about which I talked yesterday, one of the new kids in the block, it costs almost $30,000 in the US. And with millions of patients, these are extremely costly devices to use. So the first thing to understand how yoga helps is to understand a couple of basic pathophysiology. So the core reason of problems in heart failure that leads to recurrent hospitalization also is the exercise intolerance. And that's because of four main things. One is there is reduced pulmonary reserve, there's reduced cardiac reserve, there's dysfunction in the pulmonary vascular bed, and then there is structural abnormality, which is an important concept that I'll bring out, and then we'll talk about this. So there's low blood flow during exercise, which causes exercise intolerance, decreased cardiac output. As we know, there's skeletal muscle dysfunction, which was principally initially believed because of low cardiac output, and I'll just show you that's not actually true. There's, of course, physical deconditioning, because as you stop doing exercise on the long run, you'll become more and more deconditioned, and there is a gross derangement in pulmonary function. So if you look at the neurohormonal activation, I don't want to go into the details. These slides are available, and I can absolutely send it for people because of the year of time. But basically, all the bad players are activated in heart failure. Noradrenaline is 9 times the normal level. Interleukin-6, one of the most toxic chemical known to mankind. As you know, millions of people died due to COVID because of high level of interleukin-6, 80 times, 100 times, and this killed people in 5 days. The lungs were completely damaged. The heart was damaged. They had clots all over their body. So these are some of the most dangerous chemicals. CRP levels are increased, leading to more atherosclerosis in people with ischemic cardiomyopathy. And so the question is, it's an inflammatory milieu all over the body. So though we think heart failure says it's heart failure, but unfortunately, heart failure is not a disease of the heart only. It's a disease of every organ of the body. It's a systemic inflammation affecting every organ of the body. So one of the things that we know is if you look at VO2 in patients with heart failure compared to normal, there's a gross reduction of VO2. So initially, as I said, it was believed that it is just due to chronic low perfusion. But now we know, yes, chronic low perfusion initiates it, but it is not perpetuated by chronic low perfusion. What perpetuates it is the change in the muscular genes, so that the anatomic concentration of the genes, the molecular phase of the genes that is completely changed in the skeletal muscles. So you start having actually qualitatively abnormal muscles, and that is very important to understand. So despite the fact, and I'll show you that, whereas the exercise limitation initially could be due to low blood flow, but exercise limitation on the long run has because there is change in the muscles. And how do we know that? This is a very good study that Butler and other people have done. I know Butler was here in your program. we have so many good drugs which increases cardiac flow. Hemodynamically, people get back to normal. But what happens to the VO2? It still remains bad. So now we understand the reason is there's actually a molecular change in the nature of the muscles due to chronic hypoperfusion state. So despite the fact that you might increase perfusion, you might bring back hemodynamic stability, it doesn't make a change. So couple of things that it's important to understand, as I said, heart failure is not a disease, it's a syndrome. It does not affect only the heart, it affects every organ in the body. So that's where it is important to understand, because that's where yoga does what most drugs fail to do. Number one, the quality of life. So it's a reduced quality of, you might give them 22 drugs, still they'll have reduced quality of life because it's a progressive disease. Second is mental health. Most people have depression, anxiety, and you might give, they are on 22 drugs. On top of that, you can add an antidepressant. It works sometimes, it does not work sometimes, especially if there are multiple events, multiple hospital admission, there's post-traumatic disorders. So it's a complex mental, plus there's dementia also, as there's decreased vasculature to the brain. I'm not talking about vascular dementia, even in other forms of dementia. Plus, we know through functional MRI certain things that we never knew in the history of medicine. For example, when you have heart failure, when your cardiac contraction doesn't do very well, there's decreased flow of CSF. So CSF is the kidney of the brain. So there's decreased clearance of kidney, and now we have direct evidence that there's more beta amyloid deposition in the brain leading to Alzheimer's disease and other forms of dementia in people with heart failure, because there's decreased clearance of CSF in these patients. And more importantly, what about the comprehensive care? Like, you have to be ready to treat yourself. You have to take those 22 medications at the right time. You have to take the appropriate diet. You cannot drink a bunch of water, go on an alcohol spree. So this needs a complete change of lifestyle. There is no medicine known to human being that can change lifestyle. In fact, that's why it is said the biggest lifestyle medicine today is yoga, because over 300 million people practice it. Whether you're dealing with post-MI rehab, yoga has a big role in that. As you know, there are a couple of studies actually from India published in Circulation. And even in this country, there are tons of studies, and I'll just show some of them. Times are short. So comprehensive self-care is a very important component that if you, as I said, I can write as many medications I can spend tons of money giving them all the devices known to earth, but that will not help him until the patient understands that he himself has to be a physician in 30 to 40% cases and make sure he has the appropriate diet, takes his appropriate medication, does what is needed to keep himself healthy. Sleep deprivation is another big problem. Now we know the sleep biology and the problem it creates all over the body, including changing muscle characteristics, skeletal muscle characteristics. So, and there is no known drug. We have, like, every day I'm finding a new drug coming out for sleep. And as all of you know, there is not even a single drug that can mimic exactly human sleep biology. So some of this drug actually increases or decreases your REM sleep, so which causes more disruption in your normal biorhythm. Next is social and spiritual support, because with such a severe illness, it not only hurts the patient, it hurts the family, the wife, the father, the mother, doesn't matter, the children's. So this is not a disease of a person. This is a disease of the entire family and sometimes the entire society. And that leads to increased cost, because a lot of government has to provide excess support to that. Send in nurses at home, have a social worker go and visit these people. And all of them comes with a huge cost. Last and not the least is the complex regimen. It's a polypharmacy, and there are multiple medications to be taken at multiple times of the day. And as I said, we as physicians might finish off writing the medications, but they're as good as zero until people really follow all of them. And that's where we have yoga's role. Now, cardiac rehab and exercise in heart failure is a well-known fact. I don't want to spend a lot of time on that. I'm just going to give you one particular study that clearly shows that increased exercise, there's lower heart rate, improved diastolic function, improved endothelial function. skeletal muscle oxidative capacity increases so that at less oxygen, it can do better, which is actually needed in heart failure patients because of hypoperfusion. There's enhanced vagal tone and lower sympathetic tone. As I said, there's 9 times increase in noradrenaline in all the bad players. And that's why you have arrhythmia, sudden cardiac death, VT, VF, name it, AFib, name it. And there's reduced inflammatory cytokines, and these are dangerous chemicals, TNF alpha, interleukin 6, and we saw them as physicians during COVID. They killed millions of people. Virus did not go directly and kill people. It is the cytokine release syndrome where we ourselves released a bunch of cytokines in response to the virus that killed millions all over the world. And as you know, now we have drugs against interleukin 6A, but they're not that effective, unfortunately. So, and more importantly, not only the soft things, but also the hard things like lower mortality, hospitalization, they have all been proved to happen with exercise like yoga. Now without wasting much time, let's go directly into yoga and give you a taste of what we have scientifically based on actual research, rather than being biased about yoga. So this is a randomized controlled trial which shows EF, pro-BNP level, and it shows that small number of patients, but as you can see, pro-BNP and EF shows increase in people. Just 8 weeks to 12 weeks of yoga practice can bring those true. And these are all some of these are randomized controlled trials so that we try to remove bias as much as possible. And so it does. How it does, we'll talk a little bit later on, but it does. And the cardiac autonomic system, as you know, is completely messed up with massive discharge of sympathetic drugs, sympathetic hormones, and decrease in parasympathetic, leading to a lot of pathophysiology. So this study actually shows that starting from heart rate, systolic BP, diastolic BP, everything is reduced in yoga patients. And as you know, this is, if you look at the before group of heart rate, 96.36, and after is 81.48. This is important because, as you know, a lot of heart failure patients, after on maximum dose of beta blocker, we have to go for fuzzy channel blocker like ivabradine to control their heart rate, because heart rate is directly toxic in these patients. So if you can do them by practicing exercise less than 20 minutes in a day, I think it's going to be much cheaper. And some of these drugs are pretty costly, at least in the US, where there are insurance that supplies, but countries like India, China, and some countries in Europe, you may not have insurance supplying, so people have to buy it. Other than the 20 drugs they're taking directly because of heart failure, they have to buy these specialized drugs, which increases the cost both to the person as well as to the insurance companies and certainly to the government. In societies like what Dr. Ramkrishna was saying in AIMS, which is a government facility, so government has to provide those drugs. So this study, as you can see, that what is important to understand is there's 15% reduction in heart rate, 6% reduction in systolic BP and diastolic BP. But remember, see the control group. The control group are people on GDMT. These are not Tom, Dick, and Harry with no drugs who have heart failure who are in the control group. So this is the additional effect that you get due to yoga, which is not found in other cases. This is another time. I purposely brought up this study on African American. You might think I'm talking to an Indian audience. Why am I talking about African American? The reason is, as most of you know, African American parallels what Indian scenario is in America. African American, like Indians and Hispanics, have 1.5 to 2 times more chance of having coronary artery disease, ischemic cardiomyopathy than a typical white Americans. So it is important to understand that their physiology is quite different from the physiology of a standard American Indian in America. Whereas African American and is similar. I'm not going to say they are same. There are a lot of differences, but at least there are some things that are same. So in this test, you see their P of VO2 increases, and in just 2 months' time, there is a statistically significant increase in VO2. As you can see, the P is 0.001. There are other things also, but 2 important things I wanted to bring out. One is IL-6, that is statistically improved. As you can see, the CRP is also statistically improved. And the presence of oxidants is decreased statistically. As you can see, the EC sodium is 0.001. These are all statistical significance. So it's not voodoo just because people think, oh, yoga must be some sort of voodoo, some sort of religious nonsense. No, yoga is a medicine, but it has to be practiced by physicians like you and me. You cannot leave somebody who can stand on his head for half an hour and is a great yoga teacher to show you how to do yoga, because these are uneducated people. Standing on your head for half an hour doesn't make you a yogi. So it's a complete science that we need to practice. And the good news is that most of this science have been brought out by people who, A, were not Indians, B, they certainly don't belong to a Hindu religion. Quite a few of them are Muslims or Christians, and they have showed the power of yoga. So we as physicians, certainly in India, should take this over and see how we can benefit our people. Next is this is another year showing the IL-6 value in 2 months, significant decrease in IL-6 value. There are innumerable studies on this. And as I said, I'll send you this. I can send this PowerPoint. Feel free to use it. There are actual references given. You can check with that. This is another one with CRP, and the CRP is also reduced considerably in 2 months. This is a study which is a little different. I wanted to show about using meditation, and this is really an interesting study. So if you look at the survival with meditation, there was no statistically significant improvement in survival. I'm not surprised, because there are tons of drugs we have. Hydralazine, none of them improves mortality in heart failure. And this is not only for cardiology. There are actually drugs for a lot of other diseases which do not decrease mortality. But look at the other factors. Look at heart failure, cumulative AF, persistent AF, sustained VT, ablation for VT. Everything is reduced with meditation. And if you look at the slide down, figure 2 here, you can see the control and the meditation. And remember, again, just want to remind folks that control are not Tom, Dick, and Harry with heart failure we just brought in. These are patients who have been on standard medical therapy. So these are all added effect. People with VT, as you can see, is significantly less with meditation than control. And I will talk a little bit about that large part of the chronic diseases have a very strong mental component. Gone are those days when we think a few diseases are from the mind and the body, and that's we call them psychosomatic illnesses. Now we know almost all the chronic non-communicable diseases have a very strong mental component, and we need to address that in modern medicine. So the most important thing is that yoga is cost effective. You don't have to go to any costly facility, take costly drugs. You can practice at home. And almost all the top, cardiologists got beaten here by cancer specialists, because as you know, all the top cancer hospitals in America has yoga departments where people are taught yoga. And I think it's time that cardiologists pick up the baton, and we have to show, because the number of people dying because of heart disease is twice that of cancer. So if those guys can do it, there's no reason we cannot do it. We have the knowledge, we have the technique, we have everything. We just have to initiate these in our daily practice. So these are a bunch of studies, and I just put 5, 6, 7, and I think there are innumerable studies at every stage, which shows that yoga is way cost effective, less costly, with additional effect than any other treatment faculty that's known to mankind. So as I said, this is a study on depression and heart failure. Again, I want to bring in some really chronic stuff, which is very important to understand. So there are complete changes in the brain chemistry. I don't have time because it's 20 minutes talk in depression, in heart failure. So not only there's depression, there's increased production of certain things like dopamine, decreased serotonin receptors in there. So these patients are chronically depressed. Not only are they chronically depressed, they are stressed out. And when they are stressed out, there's more release in interleukin-6, more release in TNF-alpha, more release in inflammatory biomarkers. And that is an important concept to understand. So you can give them drugs. Plus, some of them don't sleep because there's a chronic sleep deprivation because of posture, because they cannot sleep when they lie down, they get breathless, so they're sitting on the chair the whole night. And some people, even they may be able to sleep because they do not have any breathlessness, but that sleep is not the pattern completely changes from the normal sleep biology. So these are the patients who you can change. And so this is a study using functional MRI that clearly shows that in these patients, you can, by teaching them meditation, by teaching them yoga, you can actually change the brain neurocircuitry. Now we know with 4 to 6 weeks, we can have neuroplasticity. These people have more dementia. So what do you do for dementia? Now we know BDNF is released in the brain in people who practice yoga and meditation. In 2010, Sarah Laser from Mass General Hospital actually showed that you can make your brain grow if you practice meditation. So we don't have many good drugs for dementia. Now you know that just by practicing meditation, you can actually make your brain grow. After that, there are over 100 studies using functional MRI, PET scan that shows that you can have brain growth by people who are regularly practicing meditation and yoga. And also when you teach them yoga, you don't teach them a physical exercise, unlike teaching them Pilates or teaching them Zumba. You're teaching them a science that is going to change their lifestyle. They become more adherent to diet. They'll become more adherent to taking the drugs at the right time. They'll be more adherent to following the norms that you prescribe them. And that's what increases the treatment of everything that you do, whether you're giving them drugs, whether you're putting in an ICD, whether you're giving them CRT, everything needs dedication on behalf of the patient. And that's what is important to understand, that yoga is not one physical exercise. And that's the other problem. Most people in India and certainly in America think yoga is just asanas. Yoga is not asanas. Asanas are just 5% of yoga. And asanas help. As I said, there are tons of studies that asanas help, but there are breathing techniques which are needed. Like this is a study which shows that when you do what is called pranayama or pranic breathing, that is taking a deep breath, you actually increase the flow of CSF. This is using functional MRI. You increase the flow of CSF. So you will have decreased chance of dementia. Maybe you will be, we don't know that details, but now we know that it might also affect release of BDNF and other factors inside the brain. So maybe you will have more factors inside your brain that will prevent you from getting dementia, decreases in stress. That we know, because there's a complete change in the neurochemistry of certain parts of the brain when you practice yoga and meditation for a long time. And as I showed, I mean, by clinical research, we know there's decrease in interleukin-6, CSF, and all the inflammatory markers that perpetuate yoga. So what is the mechanism of yoga? Honestly, we don't know. I mean, there's a lot of studies. Maybe we'll give a Nobel Prize in the upcoming years, but what we know, I'll just talk about this. Number one is vagal stimulation. So we have something called BAT, where we use, it's a new device that has come. We make a small slit in the carotid artery here, put in the leads, then the electrophysiologist tunnels it down and puts in the main devices here. So BAT is one of the newer therapy. But yoga is the 10,000-year-old drug for increasing vagal stimulation, and there are billions of studies on that. So instead of going for a $60,000-$70,000 device, which a lot of people cannot afford, why can't we start with vagal stimulation at home without having to spend $60,000 and newer technology and newer set of people to teach? Second is perceived stress. That's very important, because we now know almost all the NCDs, whether it's hypertension, whether it is diabetes mellitus, whether it is heart failure, everything has a very strong stress component. And not only that, in human being, when you have stress for a long time, there are genes like the CTRA genes which get activated. And these genes causes more release of this inflammatory parameter. So you might give them drugs. Drugs do bring down inflammatory parameters, but not to the extent as I showed. When you other than drugs, also increase their make them practice yoga, meditation, and other things. And as I said, yoga is not just a physical exercise; it's breathing techniques, which increase vagal, which decreases stress, which increases CSF flow, which causes neuroplasticity. Then there is dharana, dhyana, and pratyahara is called concentration. Then we have dharana, which is mindfulness. So we know there are tons of studies with MSBR and mindfulness to show how heart failure patients benefit that. And these studies have come of late because they thought that they discovered a new thing. And mindfulness is no new. Mindfulness has been there for 10,000 years in yoga. we have never used it. Now that we are using it, we are finding the benefits. And then, of course, there is meditation or dhyana, which is on top. Last but not the least is these toxic chemicals cause myocardial stimulation, musculoskeletal stimulation. And that when you practice yoga, physical yoga like asanas, you do musculoskeletal massage. And there are a couple of studies taking muscle biopsy showing there may be partial reversal of calcium loading and a bunch of other molecular mechanisms. That is, as I said at the beginning of my talk, that is actually responsible. Initially, it is the low flow, but in the long term, it is no more the low flow. It is the change in muscle genetics that causes a weak muscle, and that weak muscle, unfortunately, cannot tolerate any form of exercise. Now, this is, of course, the tip of the iceberg, and we have more and more studies coming out every day. I mean, cardiology is possibly one of the most researched science in medicine. But every day, when we wrote the guidelines for the American Heart Association on the role of meditation in cardiovascular disease in 2017, we had to go through over 6,000 papers. In 2020, I was asked to write an editorial article for a journal. I had to go through over 4,000 articles. So slowly, yoga is becoming one of those subjects which we are bringing into main medicine. But I think all of us can play a bigger role. We cannot let some class 8 failed guy to teach yoga just because he can stand on his head, or a completely uneducated guy, because yoga and yoga therapy is not same. Yoga therapy is medicine. If you do not know medicine, you do not know yoga therapy. So we as physicians, we as cardiologists, to take the brunt of teaching our people. It doesn't mean you have to physically teach them. You can have a yoga person who can teach in your clinic. But you have to understand the science and explain the science to the patients, so that yoga is no more considered some spiritual nonsense, some religious nonsense, but actually therapy if appropriately used. So this is one of my last slides. I don't know how much time I have. So one of is, so yoga therapy, number one, starts from the brain. There is, as I said, just like heart failure affects, heart failure is not a disease of the heart. Heart failure is a systemic disease. And it impacts every organ of the body, starting from your hair to your toe. Everything is involved, and certainly the biggest organs of the body. The most critical organ that keeps you alive, keeps me alive, like the brain and the kidneys, gets much lesser blood supply or nutrition than it needs. And large part of this can be reversed with a combination of drugs, therapy, devices, and the use of yoga simultaneously in this patient. So in the brain, there is perceived stress, poor quality of life. And again, that's a very, very important concept that we are understanding now. You can give whatever drugs you want, doesn't work until patient actually takes it. So you got to have what is called lifestyle medicine, which is coming big in America. And the largest lifestyle medicine practiced by 300 million people all over the world is yoga. So you have to tell people that they have to follow appropriate lifestyle. So teaching them yoga is the best way, so that you're not only teaching them one faculty, but you're teaching them multiple faculties to take care of everything. Secondly, of course, vagal nerve stimulation and improved biomarker effect, which we clearly showed. And factor third is changing of the muscle biology back to normal as much as possible. And that's also important because a lot of symptoms, a lot of hospital admissions are due to some of these effects. So in conclusion, yoga is a flexible form of exercise therapy, and if from heart failure patient to a normal patient, you can be individualized so that you can, based on their clinical condition, you can actually individualize. Yoga has a positive effect on sympathetic, parasympathetic balance and the HPA axis. Cortisol is decreased. Tons of studies, salivary cortisol, 8 a.m. cortisol, a lot of things are decreased. Some of these cortisols are 20, 30 times increase in heart failure. They are decreased. And that's why they have both B and T cell abnormality, as you know. They tend to catch infection very quickly. And there are studies on that too. Too less time to talk in a 20-minute talk, but just wanted to bring that to your notice. Improves quality of life, and that's the biggest part. Yoga changes lifestyle. If you have a patient who you give everything, the improvement will be less than 30% if he or she does not change his lifestyle. So yoga is a must. because yoga not only brings in a completely new paradigm of existence, but yoga also improves the very medicine that you are actually providing him to improve his cardiac health. So multiple multi-standard studies are there, but we need still more studies, especially from India, which is the mother place of yoga. And you guys treat some of the sickest patients in the world. So if you could bring more research to the table, that will be absolutely fantastic. And the world is opening its arm to see how India can bring some of the research to the table, because after all, you and I understand yoga maybe a little more than a standard American or a standard European, given the fact that we have been exposed to it since our birth. Given the epidemic of heart failure, yoga will absolutely be cost-saving. It will be saving in millions. And last but not the least, yoga changes lifestyle and makes all therapy, whether it's drugs, whether it's rehab, whether it is devices, more effective. Thank you very much.
Thank you, Indranill, for the nice deliberation and the very detailed discussion, starting from the pathophysiological basis and how yoga helps to alter it. Shubhra is there. How much time do we have to discuss? Can we have a few minutes?
Yeah, certainly. We can go ahead, have a 5 minutes for discussion at least.
5 minutes or 10 minutes?
Well, 10 minutes if you wish. We have passed the time, but we
Because
still
if we allow
last program, so we have time in our hand.
Indranill to talk on yoga and the different diseases, not only CVS or heart failure, he can speak all together, hours put together, but we have to limit our discussion. And what I understand from Indranill's talk, that he has already summarized. I'm not going to summarize his talk again. That will be taking our time. But I think there are certain preventive roles also, because if you practice yoga from the early life, not after the disease has developed, it will take care of the many of the risk factors in our life that ultimately lead to whatever form of heart failure you talk about, whether it is reserve ejection fraction, MREF, or even heart failure, because it takes care of hypertension, takes care of coronary artery disease, takes care of muscle physiology, including cardiac muscle physiology. I'm not talking about skeletal muscle physiology. So, Indranill, can you highlight about the preventive role in a couple of minutes?
Oh, absolutely. You're absolutely right. That yoga is possibly the most powerful preventive medicine known to mankind. I'll give you an example. In 2020, there was a study in the American Journal of Family Medicine where they compared Pilates and Zumba with yoga to reduce blood pressure. Systolic blood pressure was reduced 25% more with just yoga. So this common people have an idea, oh, any exercise is fine. That's not true. That's because we don't know the science. Now we are knowing the science. Whether it is HbA1c control in diabetes, HbA1c control in diabetes is 22 to 36% better when these guys practice yoga. Because what we have to understand that I am taking a bunch of insulin. What is insulin doing? Insulin also is an inflammatory factor. Insulin also increases inflammation. But if I take a bunch of carbohydrate with my food and then go on taking a bunch of insulin, it's not going to help. And that's why FDA has made it clear that for diabetes, you just cannot have an anti-diabetic drug. You have to have an anti-diabetic drug that is cardiovascularly positive, that decreases cardiovascular mortality. So preventive wise, whether it is developing hypertension, developing atherosclerosis, as we know, starts developing in second week, sometimes even earlier, second decade, sometimes even earlier. In America, technically, if you take the normal weight, in America, by definition, normal weight is above 25, you have 66% with obesity. But that is actually an overcount. You should actually take 23 to be your BMI. If you take 23 to be your BMI, 76% of Americans are overweight. So what are these guys going to do? They are going to have malignant heart disease. They have inflammation. Obesity is the biggest cause of inflammation in any human being. So they are going to have coronary artery disease. They are going to have stroke. They are going to have peripheral arterial disease. They'll have their legs chopped off because of severe peripheral artery disease and neuropathy in diabetes. So each and every one of this is completely preventable. if you start, say, from second decade of your life, most of these are preventable. And now we know there's nothing called genetics. Genetics doesn't even work. What works is epigenetics. So you can change your genes. So a lot of people tell me, oh yeah, I mean, of course, exception are those single genes, like you cannot change your genes that will cause, say, single gene disorders. That's different. In general, I'm talking about it is more the environment than the gene specifically, which is. So expression of the genes can be changed with yoga, which we now know. And that's how Elizabeth Blackburn got her Nobel Prize, when she showed that when you practice meditation, telomerase, the cell life increases. She got a Nobel Prize in 2009 on that. So the question is, every aspect of cardiovascular prevention should be taken into consideration, because we have an epidemic going on all over the world. India may become the 5th largest economy, may become the 3rd largest economy. But if you have a cardiovascular epidemic, all those gains you make will go to the drain, because it's important to remember we cannot even treat all our TB or malaria, which cause 22.6 thousand times less than treating a heart disease. So how will you be treating millions of people with heart disease? So it's important to understand that the only way, as we said, that the only way is prevention. And even not only, and the yoga does everything: primordial prevention, primary prevention, secondary prevention, and tertiary prevention. So there's no level of prevention that you cannot do from yoga. And this is based on science. I mean, as I said, in this book, every chapter, every line we said, we have given references, so that people can know that this is not some nonsense we are talking just because I'm from India and I've done yoga for many years. So every sentence, and as I said, a lot of the authors are not even Indian. They have never been to India. So that's where it is. You're absolutely right, sir, that yoga completely changes the milieu of even getting a disease, which is called primordial prevention, particularly cardiovascular disease.
Another thing, as my younger brother from the son of Kolkata, I would request you to send us certain list of asanas, breathing techniques, etc. Because majority of us are not trained about yoga therapy. Though some young cardiologists are taking up as a lifestyle, you may be knowing them. So we have got our WhatsApp group, you have your publications, books, but some means I think you can contribute to our knowledge.
Absolutely.
So that we can take the help of yoga gurus or yoga therapists, that this is the way we want it. Because I may not be showing all the yoga postures, may be difficult for us, but the younger group, a patient, whether he is suffering from a heart failure or not, at least knows that these have to be done and in this way. So we have to have a certain kind of algorithm that these are the techniques that have to be followed. As you highlighted, it is not only the postures, it is meditation, it is breathing exercise. So that will remain for future before I hand over to our panelists for certain comments. I find Pawan is there and Anil is there. Yes, please, Indranill.
Thank you for saying that. I have Shubhro's email. I'll send Shubhro the electronic copy of the book. Please feel free to give it to.
I have got it in my hard disk. I also probably will be
CSI. Yeah, feel free to give it to everybody, Shubhro, so that people can make use of it as much as they can. And this has all those, like what exercise to use, how exercise to use, and the science behind it. And that is more important, because if we don't know the science, people think it's some ritual and some religious nonsense. And that's how everybody fools us, including some of the gurus. They just fool us because they have no knowledge. They just want to increase their number of followers. Somebody has a 200 million empire. They want to make it 400 million empire. So the only gurus in yoga therapy should be physicians like you and me, because it's a physical science. It is a talk about human biology. But unfortunately, it has been taken up by uneducated, foolish people, and that's why we are missing on a very powerful science.
Well, Indranill, do you think like you would need a yoga therapist when you're actually starting the program, or you can do it yourself?
You can do it yourself. The reason is that is what I was trying to bring out. You don't need yoga therapists because most of the yogas you don't have to, as I said, number one, asanas is 5% of yoga, not 100% of yoga. Even if you do not do asanas, you are going to lose 5%, do asanas properly. You are going to not lose much. Suppose I ask you to do cobra posture. So you bend your back while lying down, you get up. So that increases stretch on the abdomen and it helps supposed to release more insulin. If you cannot bend enough, or if you bend half of what you're supposed to, doesn't matter. Because that's what we have. I want to bring a change in our understanding as doctors. Yoga through physical exercise activates only 5%. 95% is by changing breathing techniques. So when you change your breathing, when you get somebody to do what is called ujjayi breath, you immediately increase their parasympathetic. And somebody doing for a long time will have constantly parasympathetic discharge rather than sympathetic discharge, because that's what changes the pathophysiology. Somebody who's practicing mindfulness, you will change the constitution of your neuron, because you know that neuron which will create a group based on what you need. If you're stressed out, the brain gets more efficient to keep you stressed out, because that's what brain is meant to be. You're born on earth to live a normal life. So if you're stressed out, brain will try to get more efficient to get you more stressed out. So there'll be more dopamine release. But when you practice mindfulness, you will slowly change the dopamine to serotonin, and then you will have a calmness, coolness, feeling of happiness. There are even release of endorphins. And if you know, I mean, it's a very interesting history. When the Israeli scientists discovered endorphin, you know what they called it? They called it anandamide. Why did they do that? Because they said it gives you bliss. I mean, you're talking of heroin, you're talking of marijuana. Body has heroin and marijuana 100 times more powerful than you get in the market. And these are released in these yogis. That's why these yogis are in constant bliss. So the question is, it's all done naturally. So that is what is important to understand, that yoga exercise, you guys can do it. Any doctor can do it, because there are pictures what to do and they'll practice. And then you can get anybody. You don't even need a yoga therapist. Anybody who practices yoga for even 6 months can come and actually show them after your office. Okay, come every week, like what I do. On Saturday, Sundays, I don't go, but I get people to come and teach them yoga. What are the yogas I prescribe? They teach them. And that's all you need to do, nothing else. You will get a better patient. You will get patient who will be following your diktat more. And you will get a more dedicated patient who will make sure that they'll never go anywhere other than you.
So is it something they have to do every day, and for what length of time?
So, Jenny, that's another. Yeah. So, no. So, you can do it 4 to 5 days a week. And length of time is 5 to 10 minutes you start with. That's all you need. You don't have to do it every day, every time. And 5 to 10 minutes you start with. Maximum you can do around 20 minutes. And I generally do tell people to do 10 to 15 minutes. In heart failure patient, 10 minutes of physical exercises, and then 10 minutes of meditation practice and breathing practice. That's it.
Are the YouTube videos available for this?
We are creating some YouTube videos. We are going to start a link of where we'll be creating YouTube videos for this. Till now, that is there, but there is one YouTube video that we brought about the science of yoga, and I can again send it to you guys. I have all your numbers, and I'll send it to you guys, which also you can send it to everybody. And that's scientific overview. But we are creating an entire series of 12 every once a month. We will talk about yoga and genetical changes, yoga, hyperlipidemia, yoga, hypertension, yoga, diabetes, and everything that we talk about is 100% science. And what I do also, you saw some of my studies, I don't even name Indian researchers, and I purposely do that. When I'm talking to an American crowd, they understand that I'm talking completely non-biased, because the moment I try to show Indian researchers, they'll say, oh, these guys are coming from India and spreading yoga, which doesn't work. So most of my say, they are either Christians, they are Muslims, some of them have never been to India ever. But they're just physician scientists like you and me. So they are showing that yoga works and yoga is so powerful. NIH started a whole group of department with multi-million dollars to just research on yoga because of this. So that's what I think we need to. We need to take it out from the hands of gurus and illiterate people and bring it to the year of science. Bring it to the realm of science. And that's what I think each and every one of us can.
Comment?
While prescribing the patients about medications, fluid restriction. Then he mentioned about walking, exercise, but faintly mentioned about yoga and meditation, because we don't exactly know what not to practice, at least. Like pranayama, there should not be possibly long breath holdings. Like asanas, if possibly in heart failure patients should not have a lying posture, asanas are the chair or wall support asanas like this. So you should exactly know which asanas or pranayams. These we don't know, and there is no properly trained, as you mentioned, there's no properly trained persons, and the gurus may be worse for the heart failure patients, at least. That's the problem. We don't have a proper cardiac rehab center, and we don't have a proper yoga prescription. What do we do exactly? We mentioned about yoga, faintly mentioned yoga and meditation, because they don't know exactly what to say, which asanas, which.
So that's where,
how long, as Subra also asked this question, how long, for how many days, all these things. Because
no, Dr. Paul, that's why books like this are important. This is the first book that has come out, and next book will come out next year. That's by Elsevier, the people who published Braunwald. That is, the Elsevier book is going to come out next year. So this exactly tells you those. But so if you read the heart failure chapter, they're all by heart failure specialist cardiologists here in the US. They tells you what you want to start with. So this is what I tell my people. If you just tell them yoga vaguely, they are not going to take and understand it. So you have to give them a cheat. Exactly. Give them a plain, simple cheat sheet. In that cheat sheet, you can say, just do this for 5 minutes. Sit down and practice this breathing. Yeah, there's no question of breath hold. Tell them no, there's no breath hold. Just take long, slow, deep breath. Release long, slow, deep breath. That even after acute heart failure, discharge from the hospital, they can do it. In fact, they don't even have to do full asanas at all for the first 3 months. They can just practice breathing, and they can practice meditation, which anybody can practice. Even in your hospital with your fluid overload, you can practice meditation. And that doesn't harm anybody, but does bring down all the stress and neurochemistry of your brain. So that's the way you have to do it, because we have to bring this science to the bedside. Otherwise, it will remain an esoteric science, and some people will take advantage of this to make money. Whereas we as doctors who should actually be practicing it, we will be at a loss.
It's definitely a cost-effective and safe therapy. Very cost-effective and safe therapy, and untapped, as you said.
So I think every good thing has to come to an end, and we have discussed a long thing, but we'll be waiting for further talks from Indranill, and also demonstration, if possible, with his assistant, so that while he talks and speaks, we see somebody doing and practicing these things. Particularly meditation, I think it's a difficult thing to learn before somebody tells how to do it. Otherwise, just they will concentrate. They don't know what to concentrate upon. So just a concentration is not something like that. So we have to have some guru like Indranill to spread the knowledge and expertise. And if the doctors are taught this, it will be most cost effective, because they can treat, not only the patients, but also the society at large. So with these words, I hand over to Subra for concluding remarks.
Well, thank you very much. I think we must get that book by Indranill, which we can actually spread among ourselves as well. So first we must know before we preach. So with this, I think, and as Dr. Dashbishar has said, all good things come to an end. So I understand. So it has been a good sort of conference so far. And we had delegate number 491 delegates here, I think, which is really, really good. And
another information for Indranill, it is not only the Calcutta or West Bengal people that they have logged in. There are people outside.
It's nationwide. Nationwide, Dr. Mishra, now just for the records, we have to give the vote of thanks. So will you, or should I?
Well, I should say it's a wonderful program, and some of the ideas I floated, Dr. Shura Banerjee and Dr. Shamit Kumar have put it together in a wonderful way. We have covered a wide variety of topics, which means all the age group heart failures. We have covered all the therapies in heart failure. We have covered majority of etiologies of heart failure and all the newer device therapies as well. So hopefully it has been a good learning experience for people who have participated. And perhaps one of the most important things, we really put it in a little different fashion. We gave enough time for discussions, which was important because that is what stimulates the minds. I think that was very interesting part of it, and that also helped us to keep in time. Thanks all the speakers. They've done a wonderful job. I'll hand over to Dr. Shubhra Banerjee to give the vote of thanks to everyone else.
Yeah, well, I'd just like to thank the speakers, the chairpersons, the panelists. I'd also like to thank Tuli, Koshio, Oloka, and others from Mind Vision who actually coordinated the program, and Ujjal Bhatia and Pankaj for the audio visual. And of course, the CSI staff who has always been there throughout, and our anchor, Chandrima Roy, who actually is a professor in English who teaches in a college. And of course, I hope I'm not leaving anyone out. Yeah, but of course, all the delegates, without their presence, it wouldn't have been really a successful conference. So with this, let us end over here. Thank you all. Thank you so much for being with us for the last 2 days. And special thanks to Indranill as well. You must be rising early in the morning to attend our conference, I believe. Yes. What's the time?
So my suggestion is very little.
My-
I think I suggested his name and you gave him 2 topics. Thank you for that.
Oh yeah, this topic, this heart failure, CCM was suggested by me, and Arup actually suggested this yoga thing, which I think was a really nice, excellent suggestion on his part.
Yeah, no, it did. I didn't have to rise early. The reason is I always rise early to do my meditation, because early
great.
morning, if you don't do your meditation, once you're out in the hospital, the whole day goes busy. So I get up pretty early every day.
So it has
Great.
to be a part
You
of life.
practice what you preach.
Yes.
You have to, because it's worse than alcohol as an addiction. I'm telling you that. Meditation is worse than alcohol as an addiction. Once you practice meditation, you can see the changes inside you. You can see how it is. So it is worse than alcohol. You'll never, days you don't do meditation and you go out, you don't feel good.
So how
It's
do
a
you
very
put it?
powerful system. These yogis have devised a very powerful system. And now we know why it is. Because it completely changes your hormonal milieu, it changes your genes, it changes what it produces, it changes inflammation, it changes B and T cell function. I mean, we just came out with a year which actually showed that people having practicing meditation for 5 years with yoga, chance of getting COVID is almost 62 times less than somebody who has never ever practiced it. So that's what the magic is. But we need to get more science, and that will only come when people like physicians in India also get involved and start producing more and more science, so that the world knows where yoga stands.
Great. So
Thank you.
So thank you very much. So, and good night to all of you. So let's end there. Bye-bye.
Bye-bye.
Good night.
Good
Bye-bye.
night.